I know everyone says this time is different, and it kind of feels a little different this time with Russ Vought circling over the Capitol.
Well, I think the big differences are sort of twofold. One is the threat that the president made to punitively terminate government employees, which is illegal, as you just heard in the previous segment, and there's a lawsuit about that. The second, though, is I think the widespread pushback. So the Trump shutdown in 2018 was about building the wall. Most Americans really didn't care one way or the other about that. When they get these notices in their mailbox that their premium's about to double for their health care insurance, they're going to care about that. And they won't care what the spin is from Washington. They won't care what the process was. They won't care what Chuck Schumer said or whoever. They'll want to find out how to get their premiums back down, and I mean yesterday. And that's when this is going to move. That'll light a fire under the Republicans to get something done on that front.
Just on the first point about potential layoffs, you represent a district that has a lot of federal workers.
Absolutely.
Are you hearing concerns from constituents leading up to this and now that the shutdown has actually started?
Well, I started hearing concerns from my constituents from January 20th, because that's as soon as Donald Trump hit the door, he started firing government employees, and he couldn't do it fast enough for his taste. And we filed multiple lawsuits, Democracy Forward and the unions, to show that, to slow that down and address it, make sure people were getting fair treatment. But now they've hit the saturation point for sure. They're actually starting to bring some people back that they'd forced out previously because they need enough people to do the services. And there's some services that are like clinical trials for Alzheimer's research that I just thought it was crazy that they shut that down. It's indefensible, frankly. So I think they're going to turn the corner on that, hopefully, based on the pushback they're getting from within their own party and from the American people. And I think that's going to make it hard for them to follow up on this threat that they made. But you never know with those guys. You really can't tell.
Republicans remind us that these are COVID-era Obamacare subsidies, and many ask why they should still be around since the pandemic is not. What's the real answer on this? Should there be a permanent extension? Does it imply that Obamacare is not working as designed? Or should there be new rules, new guardrails about how this works?
I think there should be a permanent extension. They didn't have any trouble doing a permanent extension for their 27 tax cuts for the people that the billionaires and the really wealthy people that benefit from it. Why can't they do a permanent extension that helps regular Americans maintain health care? Donald Trump and many of these Republicans have been out to get Obamacare for 15 years now. And they found that they couldn't do it after the first 2 years because once people got it and realized how valuable it was and critical to their health care coverage, it became bulletproof. This is kind of a Trojan horse approach to taking it down. You could have millions of people that lose their coverage based on what they're doing here, and they really aren't giving any good explanation for why they won't do it.
Just for clarity, would you support a commitment to negotiations down the road, or do you want to see pen put to paper before the government is reopened when it comes to this? Two
problems with down the road. One is we've been negotiating this for months now. For example, the $1 trillion in Medicaid tax cuts, that was an H.R. 1. Democrats fought against that. Almost all of us voted against it in the House. They passed it anyway on a party line vote. On the subsidy extensions, I'm on the Appropriations Committee. We tried multiple times to put in amendments on the appropriations bills that would have given the extension at that point. They voted them down every time by unanimous party line vote by the Republicans. So they can't say we need 7 more weeks to figure this out because we've had 7 months to be working on this and have been. So my sense of this is they've been voting to kill it over and over again. Why should we assume that they're changing their minds now? Why should we credit that statement? And of course, Donald Trump has been totally erratic and unreliable on commitments that have been made one way or the other. So yeah, I'd like to see it in writing. Matter of fact, I'd like to see it get done now as part of reopening the government. We can do both at once. They really haven't given a good explanation as to it's part regular order and all this. Regular order didn't work. So now we're trying this now to make sure the American people, I think there's 15, 16 million of them that could lose their coverage. Yeah, we want to make sure they get their coverage.
Well, we all remember, of course, the shutdown in 2013 that was surrounding Obamacare. We've been going around the block on this for a while here. I'm curious to hear from you. What happens in a congressional office when the government closes? You had to probably meet with your staff. At least last time you were all in a room to let them know they were not going to be getting paid starting today. Does the office close? What happens?
No, we keep going. In fact, we've got a call tonight. It's a town hall webinar where people who are, facing these issues, the layoffs and the like, and have questions can call in, ivy.house.gov, or not call in, but tune in.
Yeah.
It's a webinar streaming to try and get information. Other congressional officers are doing similar types of things. Obviously, we're going to keep working in the community to try and help with people trying to figure out how to get
Is
through
that a
this.
motivator when lawmakers see that the staff isn't buying lunch or coming to work or getting a second job? I mean, that's real, isn't it?
Yeah, I'm a former staffer, so I know how hard it can be on them. I'm also a former federal government employee of the Department of Justice, for example. Yeah. So I know the impacts can be really tough on folks. Most folks need their pay. They need their income to stay steady. They're living paycheck to paycheck, so it's tough on them. But at least in my district so far, people seem to understand the importance of this moment, the need to make sure that health care gets extended. Because many of them, yes, they're government employees, but grandma's in a nursing home based on them getting the payments through Medicaid. They understand the fallout of what could happen here.
We are talking about the fiscal impacts, and I'm wondering what you make of Republicans' recent argument that the Democratic-backed plan could add $1.5 trillion to the national debt over the next decade. That's according to an estimate from the Committee for a Responsible Federal Budget.
It's kind of laughable because the tax cuts that they put in place in H.R. 1 is like between $4 and $5 trillion. So, I hear them start complaining about the deficit again, and I'm like, where were you when you passed this thing unanimously, essentially? So here's the issue. They're trying to do a lot for the billionaire buddies. Can they do something for the American people, regular folks in the working class? They're not trying to ask for a whole lot of handouts or anything, but they do want to just give them the chance to extend their health care coverage with the subsidies that they've been given and come to rely on. Give them a chance to continue to get the Medicaid funding that they need for elderly and the disabled and children who are poor and the like. Why are we cutting that stuff to give tax cuts for people who really don't need the money? And many of them aren't even asking for it. So it's inexplicable to me and indefensible, frankly.
I don't know how much time you spent on Truth Social, but you might have seen the videos the president's been posting about your leader in the House, Hakeem Jeffries. There was one a couple of days ago. He's standing side by side Chuck Schumer. It's an AI-generated deep fake where Chuck Schumer is saying offensive things about undocumented immigrants. And the Democratic leader in the House is put in some sort of mariachi outfit in what was deemed a sure-to-offend racial depiction of Jeffries. And he did it again last night.
Yeah, I mean...
what does that tell you about the willingness to compromise?
I mean, it tells me more than that. I mean, you start kind of wondering if the guy's really stable or not. I mean, it just doesn't make a lot of sense. The performance in front of the generals and admirals yesterday was unsettling, too, to say the least. And there's been a whole string of that with this guy since he got back into the White House. I mean, if Joe Biden had been doing stuff like this, you'd have to peel people off the walls. Oh, he's lost it, Let's, measure Trump by the same yardstick.